Most doctors still prescribe exercise in the wrong way. They say, go exercise, it's good for you. But here's the reality. Telling someone to exercise is often useless and sometimes even harmful. Because when you're depressed, anxious, or recovering from severe illness, that advice doesn't just feel impossible. It feels like failure. So let's fix this. The important thing to recognize is that it's not exercise we should be prescribing, it's movement. Movement is how the brain regulates itself. And when we match the right movement to the right phase of illness, that's when change begins. In this video, I'll show you exactly how I prescribe movement in clinical practice, the science behind why movement changes the brain, the interviewing process, the real questions I ask patients, why motivation is the last step, not the first, and how to break through barriers so movement becomes a habit. I'm Dr. Sanil Rege, consultant psychiatrist and educator. I've trained over 10,000 mental health professionals globally. And in this video, I'll explain how prescribing movement works in clinical practice and why we've been getting it wrong. Here's what we'll cover. First, why exercise is the wrong target. 2, the science of movement and the brain. 3, how I interview patients, the exact questions I ask. 4, the hidden psychology of motivation. 5, how barriers, prediction errors, and habit formation fit in. And finally, how you can use this process in practice or even in your own life. First, let's start off with why exercise is the wrong target. When we hear exercise, most people imagine the gym, running, lifting weights. But for many patients, especially those with moderate to severe mental illness, that target is unrealistic. Some patients are runners who can do 10Ks. Others play regular lawn bowls. But for someone just coming out of a depressive episode, standing up or walking to the letterbox may be the limit. So the baseline's different for everyone. And what they used to do is not the same as what they can do now, or even more importantly, what they need right now. That's why prescribing exercise is the wrong starting point. Instead, we focus on movement, matched to the right phase of recovery. Let's now dig into the science of movement. Movement is the foundation of how the brain regulates itself. Here's why. Cognition follows movement. To think is to move. Emotions come from the word immovere, to move out. Emotion. Our brain-body system evolved to stabilize mood, attention, and arousal through physical activity. So when someone is immobile, cognition slows, emotions flatten, and the system dysregulates. That's why movement is such a powerful therapeutic lever. Not because it burns calories, but because it restores the brain's rhythms. Now, how do I actually do this in clinic? The first question I ask is never, do you exercise? That question is loaded with judgment. Instead, I ask, take me through a normal day. It's open, non-judgmental, and it gives me insight into the rhythm, energy, and opportunities for movement. If the patient is in remission from moderate to severe illness, I might go further. What will your day look like when you go home? What will your week look like next month? Can you help me visualize what you'll be doing? This is powerful because that's when fears, guilt, and anxiety surface. They realize how confronting the idea of activity can be. And that's okay, because that's the beginning of the work. You see, here's the mistake many clinicians and well-meaning family members make. They say exercise is good for you, just do it. But people don't change because something's good or because someone else is telling us to do so. Change is a process. Think about addiction. It's not just about knowing cigarettes or alcohol is harmful. It's about moving through stages: awareness, anticipation, action, and then maintenance. Movement works the same way. We can't shortcut motivation. We have to build the process that gets people there. So what do I explain to patients? I tell them, movement is not about fitness goals. That may come later. Right now, it's about finding small activities across the day that stimulate the brain. Thinking, emotional regulation, play for the brain. Examples? A short walk, standing while making a phone call, stretching between tasks, walking to the corner shop. We start low and slow because the aim isn't performance. The aim is to trigger the brain's natural reward cycle. And this is what the brain's natural reward cycle looks like. Anticipation, reward, and then motivation. Motivation doesn't start at motivation. Motivation is the last step in the chain. The real sequence is anticipation, then action, then reward, and then motivation. First comes anticipatory reward, the looking forward, the imagination, the visualization. Then comes consummatory reward, the enjoyment in the moment. Only then does motivation emerge. So if motivation is missing, the problem is upstream. We need to build anticipation first. That's why small, achievable activities matter. They create matches between expectation and outcome. And every match is a small dopamine hit. This is where psychiatry gets really fascinating. So let's understand the role of prediction errors. When patients anticipate an activity and it goes well, their prediction matches the outcome. That reduces anxiety and sets up the foundation to build motivation. You see, the brain loves predictability. If it can match prediction and outcome, it's happy. But when it doesn't match, prediction error goes up. That triggers arousal, anxiety, avoidance, because it's uncertain. This is why exercise can feel so confronting. It's not the activity itself, it's the fear of mismatch. Our job as clinicians is to scaffold activities so that the matches outweigh the mismatches. That's how motivation grows. We know that this process isn't meant to be perfect, but we can build predictability through repeated habits. Of course, through this process, barriers exist: fatigue, pain, the weather, lack of time, negative beliefs. So it becomes important to address these barriers, because if we don't, prescribing exercise becomes just another failed intervention. So part of the process is exploring what gets in the way. How can we work around it? What's one small action you can realistically do today, next week, for the next month? By working through barriers, we help patients reset the balance between reward and avoidance. Notice, I still haven't used the word exercise when discussing this with patients, because what we're really after isn't sets or reps, it's play for the brain. And why is play for the brain so important? It's because the default mode network, the brain's wandering mind, resets through movement. This is the same part of the brain that is dysregulated in a range of psychiatric disorders. It's what's associated with the ruminative mind in depression. It's what's associated with pain or the intrusive traumatic memories in PTSD. So to reset the default mode network, or DMN, through movement, we could use gardening, dancing, walking, or even playing with a dog. What matters is not the form or structure, but the function. Movement that allows the brain to move out of stuck states. So when I prescribe exercise, here's what it actually means. Map a day using open questions. Provide psychoeducation on movement, not fitness. Start with anticipatory cues, not motivation. Build small, low-barrier activities. Identify and address barriers, and let motivation follow naturally. That's how we get the brain moving. So the next time you hear someone say, exercise is good for mental health, remember this. It's not about telling patients to exercise. It's about prescribing movement matched to the phase of recovery. Because when the body moves, the brain follows. And from movement comes cognition, emotion, and the possibility of change. If you found this helpful, hit the like button and subscribe to our channel. Share it with a colleague, and check out the Academy by PsychScene if you're a clinician, where we dive even deeper into frameworks that transform clinical practice. I'm Dr. Sanil Rege, and thank you for watching. I look forward to seeing you in the next video. Until then, stay curious. Bye-bye.